Doctors say insurance companies are effectively practicing medicine by deciding what gets covered and when, but they aren't being held to the same standards. It's leaving patients with few options to fight back if delays affect their health, even if they go to court. Lee Zurik explains in this permission to practice investigation.
And it's frustrating now. At the time, the anger was, I can't even explain it, even on her part.
Val Valentini says his health insurer failed his family. A few years ago, the former New York City police officer's wife, Kathleen, was suffering from hip pain, and doctors wanted an MRI to investigate a suspicious mass that turned up in an X-ray, but insurance denied the request.
So her doctor told her, I want you to get an MRI because I feel like this is what you need. And then the insurer, who never saw her, said, no, you're not getting an MRI.
That's exactly it.
It took 6 weeks of appeals, but she finally got the MRI, which confirmed bone cancer. But doctors said the delay in diagnosis meant instead of chemotherapy, Kathleen needed a significant amputation first.
She suffered for no reason.
In November of 2020, she lost her battle.
They failed her so miserably, and from beginning to end.
Kathleen's MRI needed approval to be covered in a process called prior authorization, which is when doctors submit a request to the insurance plan and it decides if it will provide coverage, often based on whether the company thinks the test or treatment is necessary. Justin Williams worked for a major health insurance company for almost a decade. His team processing electronic faxes of requests from doctors as they came in.
So every one of those faxes coming in would be someone's hospitalization, somebody's medical equipment, somebody's treatment.
Williams says over time, bosses pushed his team to focus on new and different duties. The queue of unprocessed fax requests backed up into the thousands, often pushing each prior authorization to the maximum amount of time.
It basically became clear to me that the primary function of the insurance company was not so much getting things done in a timely fashion.
Employees in departments like Justin's, those responsible for the first stage of processing requests, often aren't required to have any healthcare background at all. We found numerous job listings where representatives only need a high school diploma and customer service experience, and found online resumes of prior authorization employees whose previous work experience was listed as things like working at a hardware store or being a supermarket cashier, with education in areas like cosmetology or landscape architecture. Companies note these employees are not making clinical decisions, but some jobs include working directly with request case files.
I think we need to embrace all kinds of workers in healthcare, but it is important the level of experience and training that you have, and so we should have people acting appropriately based off of that.
Research shows the practices of physicians like Dr. Gabe Charbonneau spend around 14 hours every week on prior authorization paperwork and dealing with insurance companies instead of treating patients.
I actually think it is insurance companies practicing medicine.
Another part of what makes the process so hard to navigate for providers and patients, not all insurers have the same rules. In our analysis of nearly 100 policies, prior authorization requirements for the same service varied company to company and sometimes state to state. We tried to interview representatives from the insurance industry for this story. A political advocacy association representing health insurers refused to make someone available. But in 2018 testimony to Congress, the group says prior authorization has been effective in addressing overuse and misuse of tests and procedures.
With prior authorization, our members analyze whether a treatment is safe and effective for a particular patient based on the best available clinical evidence.
By making these decisions, people like Val Valentini and his attorney allege insurance companies are actually practicing medicine. The family even tried to sue their insurer for medical malpractice. But the case got dismissed because in New York, as in most states, there are no laws holding insurance companies to the same standard as doctors.
What they're doing is disgusting, and it's getting worse and worse, it seems.
While insurance companies say prior authorization benefits everyone, Valentini is left feeling like the system puts companies in charge of giving permission to practice.
Once again, that was Lee Zurik reporting. You can find court documents from the Valentini's legal case and more details on our team's research online now at investigatetv.com. TikTok's